Today, Samaritan's Purse is making the trip from North Carolina to the Democratic Republic of the Congo. The group is sending a response team to help with the Ebola disaster. The group is preparing a treatment center and shipping personal protective equipment to help keep healthcare workers safe. The World Health Organization is warning that new factors are raising concerns of the Ebola outbreak spreading within affected countries in Africa. There are now 139 deaths, nearly 600 suspected cases, and the WHO chief fears those numbers could rise fast.
There are several factors that warrant serious concern about the potential for further spread and further deaths. First, beyond the confirmed cases, there are almost 600 suspected cases and 139 suspected deaths. We expect those numbers to keep increasing, given the amount of time the virus was circulating before the outbreak was detected.
Now, all of this comes after a missionary group confirmed that an American doctor working in Africa tested positive for the virus this week. U.S. officials say they're working to move him, along with his wife and another physician, to Germany for treatment and care. The CDC says Ebola symptoms can start 2 to 21 days after contact with the body fluids of an infected person, and that includes touching materials of someone who died from the disease.
You sort of combine all these things, lack of testing, volatile area, some of the cuts, it's not surprising to have a situation like we see unfolding right now.
While the CDC says the immediate risk to the U.S. public is low, the agency invoked what's called Title 42. It's a public health law that restricts entry into the U.S. during outbreaks of communicable diseases for at least 30 days. That starts Monday.